Hi. Today I'm going to talk about the cerebellum. The cerebellum is often known as the second brain, and every single input in our body has to go through the cerebellum and then usually cross over to the other side of the brain. So it's very important for a lot of functions. It controls movement, coordination, balance. So we're going to just go through a couple tests so you can kind of get an idea what we do here. So the first thing we want to do is since the cerebellum terminates movement, we do the basic finger to nose, like the sobriety test, and that's why they do it, because after we drink alcohol, our cerebellum can get affected. But the finger to nose test is just your eyes are closed, feet are close together, but not quite touching, and you just go slow movements, finger to nose. If in the end of the movement, we see a little tremor, that's called a termination tremor. That means the cerebellum is not terminating that movement. So the next test is, it's called the heel to shin test. And we're just looking at basic coordination just to see if we can run the foot down the shins. And then another one is called dysdiakinesia. It's called rapid alternating movements. We would take the hand and we do this basically as fast as we can, both sides, to make sure that we can do this. I'm actually not as good on this side, so you'll see I get a little sloppy as I go faster. And then just because a test is off, it doesn't mean you have an issue, but you try to put the whole clinical picture together. Romberg's test is a very common test. That's the next test we're going to talk about. It's basically feet together, and you should be able to maintain your balance, and sometimes just give a little push to make sure that the balance is maintained. This, we're just looking at overall balance. And then we want to look at tandem gait. That is when you put one foot in front of the other. This is an advanced test for balance, and they should be able to hold that fairly well. So the cerebellum integrates with a lot of different parts of the brain, like the vestibular system and the eyes and the sensory motor system to coordinate balance. So we're checking this a couple different levels on this one. We want to make sure they can do it both sides, because the foot that is back, that's a cerebellum we're actually testing. And then we want to look at the gait. So if when a person's walking, if all of a sudden they're kind of moving off to one side, that's called an ataxic gait. That the side that they lean to is the side deficiency of the cerebellar. So when I have a patient come in the office, the first thing I look at as they walk in the room is their gait. So we're looking at different patterns. And then a couple other quick little tests. We just want to look at muscle tone to make sure that they have good muscle tone. Sometimes lack of muscle tone could be a cerebellar issue. And then the last test that I do, it's called the nystagmus test. We're just doing basic eye movements, and they're just tracking the eyes. We want to make sure the eyes aren't moving real fast. That's called nystagmus. And when they do, this is again a integration between the cerebellum, vestibular system, so the canals in the ears, with our eyes. And if they get that nystagmus, they're going to have issues of dizzy or that feeling like they're rocking on the boat. The cerebellum is very, very important to our bodies, and a healthy cerebellum is important to prevent neurodegenerative issues later. Thank you for listening.